Hello, my name is Timothy Harrison, and it's great to be with you today. I'm the Deputy Director for Strategic Initiatives in the Office of Infectious Disease and HIV/AIDS Policy at the U.S. Department of Health and Human Services here in Washington, D.C. And it is a pleasure to be with you today. Unfortunately, I could not be there in person, but it's great to be with you none the same. And I look forward to just sort of sharing a few remarks as you adventure in this conference for the next couple of days. I want to thank the participants for coming and listening to this presentation as well as the conference, but also to the organizers and for their invitation and welcoming us here to the conference. Just to start out, I mentioned that I'm with the Office of Infectious Disease and HIV/AIDS Policy. You may not have heard of that office before. If you have, you know that it's in the U.S. Department of Health and Human Services, and it's currently being led by Dr. Admiral Rachel Levine, who also leads the U.S. Public Health Service Commission Corps. Under Dr. Levine's leadership, she also oversees the Presidential Advisory and secretarial committees like PACHA, the Presidential Advisory Council for HIV/AIDS, 10 regional health offices, and the Office of the Surgeon General. So she has a full, big portfolio. Within our office, the Office of Infectious Disease and HIV/AIDS Policy, in addition to PACHA, we also manage components of the Ending the HIV Epidemic, the National HIV Strategy. We manage what's known as the Minority HIV/AIDS Fund, and we also manage something you probably have heard of called HIV.gov. That gives you just this little taste of things that are coming out of our office. Today, I want to talk to you about some of the more recent developments in the field of HIV that we've been involved with in the office, as well as some of the priorities moving forward as we look ahead into 2022. As you know, in addition to the HIV work that sort of brings us here today, our office has been responsible for several other national strategies, including ones for viral hepatitis, sexually transmitted infections, and vaccines. And we have released those strategies over the last year and are in the process of developing implementation plans to be released shortly in 2022. The importance of bringing that up is, I think, as many of you know, that it's important as we move forward and has been called out in the national strategy to work across this endemic of HIV, STI, viral hepatitis, and substance use. And as we think about the critical work that has to be done in HIV, which we'll talk more about in my presentation, it's really important to keep in mind those other areas that are really critically important. As you know, on World AIDS Day, December 1st, 2021, the White House published the National HIV/AIDS Strategy for 2021 through 2025. And this updated strategy provides stakeholders, like all of us, a roadmap to accelerate and strengthen our efforts to end the HIV epidemic in the US by 2030. The strategy really reflects the commitment and vision of President Biden's administration and its commitment to re-energize, strengthen, and expand a whole of society approach to ending the HIV epidemic. It is a response that accelerates our efforts to end the HIV epidemic while supporting people with HIV and reducing HIV-related morbidity and mortality. The strategy sets bold targets for ending the HIV epidemic in the United States by 2030, including a 75% reduction in new HIV infections by 2020 and a 90% reduction by 2030. You've probably heard this, and so I won't go into more detail, but understanding the importance of setting these broad important targets as we move forward in our efforts. The national strategy details principles and priorities to guide the nation's collective work. And over the next few years, we will be providing more details on the success of the implementation efforts that have been guided by this national strategy. I wanted to just quickly remind you of the vision. And if you haven't had a chance to take a look at the national strategy, I encourage you to do so. But it reminds you of the vision. And I think visions obviously are meant to be an elevated expectation for where we need to go as a country, as it pertains, in this instance, to HIV. The United States will be a place where new HIV infections are prevented. Every person knows their status, and every person with HIV has high quality care and treatment, lives free from stigma and discrimination, and can achieve their full potential for health and well-being across the lifespan. This vision includes all people, regardless of age, sex, gender, identity, sexual orientation, race, ethnicity, religion, geographic location, or social economic circumstance. And I think it's always important, I think, to remind ourselves that what is the end goal here. Even though some of it may seem a bit lofty, I do think it's important to keep that as the reminder as we move forward and we get into the minutia of policy and program. Just sort of looking ahead, again, the strategy is organized, but with 3 national goals that are probably very familiar to you. Preventing new HIV infections, improving HIV-related health outcomes of people with HIV, reducing HIV-related disparities in health inequities, and achieving integrated, coordinated efforts that address the HIV epidemic among all partners and interested parties. Okay, just a few details about the strategy in case you're interested. The strategy details 21 objectives and 78 strategies. As an office that worked in collaboration with the White House on this, it was really important, I think, the attention to really detailing all of the strategies that were essential work to move our needle to end the HIV epidemic. Just a couple of modifications on this iteration of the national strategy to note or to emphasize include addressing the structural and social determinants of health, including racism, that contribute to HIV risk and poor health outcomes, moving discoveries from research into practice more swiftly, and ways to accelerate availability of and access to HIV testing, prevention, care, and treatment services. As in prior iterations of the national strategy, priority populations were identified. And these populations disproportionately are affected by HIV, include gay, bisexual, and other men who have sex with men, in particular, Black, Latino, and American Indian, Alaska Native men, Black women, transgender women, youth aged 13 to 24, and people who inject drugs. And again, these were prioritized based on HIV incidence, diagnoses, and viral suppression data. Focusing on these priority populations will help us reduce the HIV-related disparities they experience, which is essential to the nation if the nation is to succeed on the path to ending the HIV epidemic. Just a couple of things to keep in mind. I wouldn't want to belabor you with too much of the data, but some things to keep in mind, which I'm sure you're very familiar with. In 2019, Black, gay, and bisexual men accounted for 26% of the 4,800 new HIV infections in the United States. Along the HIV care continuum, compared to all people with diagnosed HIV, Black, gay, and bisexual men have lower viral suppression rates. In order to successfully achieve the goal of ending the HIV epidemic, issues such as discrimination and systemic racism must be addressed. Focusing efforts on these priority populations will reduce the HIV-related disparities they experience. I mentioned the focus on the social structural determinants of health. I want to go back and sort of put a finer point on some changes in this updated national strategy that were really critical, and some things that were, of course, emanating from community suggestion. And these things include recognizing racism as a serious public health threat and the ways in which it drives disparities and affects HIV outcomes. Strengthen emphasis on better integrating responses to the intersection of HIV, viral hepatitis, STIs, and substance use and mental health disorders, as I alluded to earlier. Puts greater emphasis on the important roles of harm reduction and syringe service programs in our national response to HIV, viral hepatitis, and substance use disorders. It really underscores the vital role that the Affordable Care Act plays in our response to HIV. It adds a new focus on the needs of the growing population of people with HIV who are aging, and enhances a focus on quality of life for people with HIV. In assembling this national strategy, the calls for expanding engagement of people with lived experience is reflected in the document. And this would include in research, planning, delivery, assessment, and improvement of HIV prevention, testing, and care services. It also acknowledges populations with or experiencing risk for HIV whose unique circumstances warrant special attention and tailored services, such as immigrants, individuals with disabilities, justice-involved individuals, older adults, people experiencing housing instability or homelessness, and sex workers. It weaves HIV research activities more broadly across the objectives, encourages reform of state HIV criminalization laws, and calls for sustaining innovations implemented during the COVID-19 public health emergency that continue to support and improve access to and engagement in HIV services. It also expands the focus on addressing the social determinants of health that influence an individual's HIV risk or outcome, and adds a new focus on opportunities to engage the private sector. It is indeed a whole of society approach that involves all stakeholders actively engaged over the next several years. With the release of the national strategy, there have been some questions about, well, what happened to EHE, or what is the role now of EHE? And in that discussion, we want to underscore that the two are complementary and share the same goal of ending the HIV epidemic in the US by 2030. So HHS will continue the EHE initiative, and it will become a core component of the work by HHS to implement the national strategy. The EHE initiative will continue its geographic focus on the 50 jurisdictions where most HIV diagnoses occur, plus 7 states with a disproportionate share of HIV in rural areas. The EHE initiative continues, and OIDP will work with ONAP and other HHS agencies in its implementation to address threats to progress, incorporate the administration's priorities that are reflected in the strategy, and continue and strengthen community engagement at the jurisdictional level. The strategy is a call to action for stakeholders from all sectors of society. Federal activity alone cannot end the HIV epidemic, as you know. That's why the strategy is a national one and not just a federal one. Achieving the national goals of the NHAS will require the engagement of stakeholders from all sectors of society in a more coordinated, re-energized national response to HIV. This means finding new or expanded ways to engage and align the collaborative efforts of people with or at risk for HIV, public health professionals, healthcare providers, people working in state, tribal, and local government, leaders and staff of faith and community-based organizations, educators, researchers, and people leading and working in private industry, amongst so many others. Aligning all of our efforts around the priorities articulated in the strategy will prepare the nation toward our goal of ending the HIV epidemic, something that was unthinkable or not within our reach years before. So I encourage each of you to read the strategy. If you've not, talk within your organizations, talk with your partners and community leaders, how the strategy's principles and priorities might influence your plans, your programs, policies, and services. And as always, we encourage feedback. As we move forward in 2022, with the specter of COVID still among us, we will continue to work around this issue of HIV and this endemic involving STIs, viral hepatitis, and substance use disorders and mental health. But we will work in collaboration with all of you. Hope you enjoy the conference and learn everything that needs to be learned. And it's an invaluable experience for you. Again, my apologies for not being able to be there in person. Wish you Godspeed. And if there are any questions, don't hesitate to reach out to us. Thank you.